सत श्री अकाल जी, क्या हाल है?
ठीक ठाक.
ठीक ठाक? Okay, this is visit number 2.
2.
And we made a few adjustments.
Mhm.
Tell me if there's any difference from yesterday or day before yesterday's visit.
Yesterday.
Yesterday.
In the morning, I felt like, less stiffness in my back, lower back.
Okay, good.
Yes. I used to feel a lot, and especially in the morning.
Nothing is worse.
Nothing is worse.
Anything new show up?
No.
Okay. Do you have any questions for me?
The question only, like, I have just one question, like, I forgot to mention yesterday, I've been, like, in the construction field for, like, 18 years almost. So, I did a lot of, like, heavy lifting in my life. So, I don't know if that must have happened, something with my back.
Sure.
That came up.
So
No.
that's a good question. There's a concept I want you, and I want to share this information with people. It's called a fulcrum weight distribution, right? Now, let's say I'm standing like this.
Mhm.
Okay. As soon as we bend 45 degrees forward,
Mhm.
the muscles are electrically silent in the back. It's
Mhm.
the ligaments holding things.
Mhm.
There's also a 10-to-1 fulcrum weight distribution.
Mhm.
So number 1, at 45 degrees, bending forward, those muscles are electrically silent. It's those ligaments holding. Okay. So that's number 1.
Mhm.
Number 2, number 1 common mechanism of injury of low back pain, how do we injure it?
Mhm.
Is bending and twisting. Okay. Number 2, the 10-to-1 fulcrum weight distribution.
Mhm.
So once we're past that 45 degrees, we're
Mhm.
electrically silent
Mhm.
in terms of the muscle, ligaments are holding, and now whatever you're carrying, it's
Mhm.
10 times the weight on your low back L5 disc.
Mhm.
So upper torso average 100.
Mhm.
Take about 100 pounds.
Mhm.
Let's say you're carrying 50 pounds.
Mhm.
50 pounds, that's 150.
150. Yeah.
Times 10 is 1500.
Yeah.
What can the L5 disc hold in PSI? About 980. Okay?
Mhm.
So what's happening? Everything is tightening up.
Mhm.
And then as you're bending and twisting, doing this all day, we're getting these repetitive strains.
Mhm.
And as I mentioned, there was few injuries there.
Mhm.
And whether that happened on the job site, that's not what we were talking about.
Mhm.
Well, it's the work you were doing wasn't allowing you to heal.
Mhm.
Does that make sense?
Yeah, it does.
So, important, fulcrum weight distributions.
Mhm.
When we're bending forward, right? 45 degrees, we're lifting this 20-pound box.
Mhm.
This 20-pound box is like 200 pounds when you're like this.
Mhm.
If you bend the knees, it's not.
Yes.
So they always take good lifting mechanics is bend the knees, bring it close to your body and lift.
And-
And the idea is don't go past 45 degrees. Take?
Yeah.
Okay. Now, can I see you walk, sir? An ounce of prevention is worth more than a pound of the cure.
Yep.
Let's watch the dimples. Walk for me, sir. Sir, we have movement in the dimples today.
That's good.
More on the right side, still less on the left side.
Okay.
But there's movement. Watch his dimples here. Good. That left one ain't moving now. Have a seat, sir, and let's get started. Let's see what we find today. Starting at the base of the neck. Tiny bit up top. 5 points. Ten points, left side. That's around your T4. T3, maybe between T3 and T6. Okay. So we're getting it, this one up top here. So from first visit, 12 is also clear, sir. And now it's all in that left SI joint. Yep, left SI joint. around T3 and a little bit here at C1, sir. Okay, shall we continue?
Sure.
Scoot forward, please. Feet together. Open and close the knees with your feet touching, sir. Good. Good. Right side only. So when he does the right, this whole thing is shifting. This whole thing is minded here. Left side. When he does the left, the right is okay. A little bit of tissue pull there, but not much. Okay, sir. Let's go ahead and come back into extension. That's 5. Take. Bear with me. 5. S1. S2. Not as bad today, right?
Yeah.
Let's do that again. S2. S1. L5.
Yeah.
Okay. Now, let's do the left side of the SI joint. Hands on your lap, please. There we go. Back towards me. Top of the joint. This whole thing is binding on this left side when I do that. So as I'm turning it, the whole thing is binding and moving. There's not independent motion inside this joint. I know L5 is tender, sir. And after we do this, we'll test that again. The pressure is not, that's not what we're adjusting today.
Okay.
Okay? Yes. I want you to know the difference then after.
Okay.
When we do the right SI joint, there's movement. Okay, now let's go up top and statically palpate. Head down, please. And running my fingers down the spine. That one more tender, or that one? Not that one. That one, or that one?
Yeah.
Bottom or top?
Top.
Top. 7. 1, 2, 3.
Yeah.
3. We'll check the left SI joint. We're going to do the Gonstead Leg Check. I need you to go face down on the table here, sir. Let me put some face paper for you. So we have a PIEX on the left side with a rotated sacrum. We're doing the Gonstead Leg Check to determine if we're going to do the pelvis or the sacrum. Now, typically, the chapter tells us, page 43 of the Gonstead chapters, if you have a PIEX on the side of a rotated sacrum, do the PIEX. Now, I just want to confirm on his case, because nothing that we're doing here is textbook in his case. So, let's take a look here. And so what we're looking at in the Gonstead Leg Check, we can see here that the left side is slightly shorter. We're going to bend the knees to 90 degrees. If the left side stays shorter, we do the sacrum. If the left side goes longer, we do the pelvis. And left side went longer. Come from behind, you can see. Left side went longer. You can see it's higher on this side. So today, sir, is the pelvis, my brother.
All right.
You ready?
Yep.
Chalo. Chin down. Look down. Bas. Gotcha. Home run, sir. Let's go face down and just breathe. All right, next thing we want to do is T3. 1, 2, 3. T3. Home run, brother. Gotcha. Deep breathing, please. And down. Now, I'm going to do your pelvis actually here, the PIEX on the high-low today. And we're going to be setting it through the joint. I'm right here, okay? Is that okay?
Yep.
Okay. I'm stabilizing the right side, so the left side is going down and out. We're pushing it up and in. Let's slide him up a little bit. And sir, I need you to just focus on your breathing, okay?
Mm-hmm.
Just focus on the breath, please. Stabilizing the right, pushing the left. A little more. Gotcha. Let's walk several times, please. As you're walking, let me know if anything is different. Sore too, yeah? Okay, let's go right side down, please. Now, the key with you, sir, is Just let me roll you the best I can, okay? PIEX, we're on the posterior lateral aspect of the PSIS. Soft pisiform, and we're pushing through the joint with a counterclockwise torque. Roll towards me. That's the rest, baby. Gotcha. Ah! Otoba. Sir,
Yep.
you okay?
Yes.
Okay, you're very quiet right now. You're feeling what's going on, right?
Yeah, trying to feel.
Keep walking. Ah.
You see my right foot, little straighter.
Sir. More important is how is the movement first in the back.
Mm-hmm.
You should be feeling a little more movement in the pelvis. Good. Let's have a seat and let's retest everything, sir.
Okay.
Awesome. Starting at the base of the neck, post scope. Head down, please. 0. T3 is clear. Good. Now we had a left break. We did the pelvis, right? We did not do the sacrum. And guess what, sir?
Mm-hmm.
Clear.
Oh.
Scoot forward. Now let's repalpate. You remember what your L5 was feeling like, sir?
Yeah.
Okay. Back slowly towards me. I'm starting lower at S2. You see how he's bracing himself? He's anticipating already. S1, sir.
Yeah. Yeah.
That's your 5, dude.
That's very less.
It's less, yeah?
Almost none.
You were jumping before.
Mm.
I didn't touch your 5.
Yeah.
And here's the thing, guys. We're not chasing the symptom. We're getting to the cause. If you were to palpate his L5, it's hot, it's swollen. Everyone would want to rush and adjust L5, but that's not the fix. And the Gonstead Leg Check, some people do Deerfield leg checks. Gonstead Leg Check is very nice, and it confirmed page 43 of the chapters and confirmed on the x-ray for us. So that was a good thing. Deco?
Mm.
Señor. Sasrikal. Nice. Take. All right. Can I continue?
Sure, sir.
Shoulders. Relax. Let me do the work. Shoulders. Bus. On your back, and let's do your ankles, sir. Straighten this leg up. Raise this leg. And down. One more time. Raise this leg. Bend the right, straighten the left. Raise it. Is that a little easier to raise?
Yeah.
I know it still hurts though.
Yeah.
Gotcha. Sit up straight and let's do the machine. And let's get your buff and polish down there. Great. So I'm focusing the buff and polish on the sacrum and the left SI joint. Break up that scar tissue so you can get lots of movement today. Very cool. 5, 4, 3, 2. Tell me when you're ready.
Yep.
Tick. Look up a little. I'm messing this all up, okay? Open so don't get mad, sir. I have to move your mustache, sorry, out of the way a little bit. I'm sorry, sir. And the reason why is I need to be able to see. Slowly close. Slowly open. Slow all the way. Look up a little more. Close. Slowly open. It's right here. You feel that?
Yeah.
Okay. Let's open and close a couple more times. I want to see from the front. Now, we're looking at the symphysis mente. Open, close, open. So it's going that way. So, what we have here, we said left EX and right TMJ. It's actually misleading. Again, do we go with the x-ray or the patient?
Patient.
Go with the patient. Slowly open. Slowly close. Slowly open. Never mind, I'll take that back. It is the right. Open all the way. Open. Open. Slowly close. Open all the way. Slowly close. There it is. Gotcha. Nice. 3, 2, 1. Put your mask back on, sir. Okay, stand up for me, please. Walk it off 2 times, and then we'll do the hands. Little bit
lighter. It's lighter.
Sure. Squeeze the hand. Squeeze. Dude, this guy got power. Ah, Tori se bati. Lune. Bas. Squeeze. Squeeze. Questions. This is visit number 2. I will see you tomorrow, sir.
Thank you.
You take care.